Hi, I'm Debora Grandison, a 35-year heart disease and diabetes survivor, living with a pacemaker, an insulin pump, and a purpose. My health journey began during pregnancy, and that road took me across many paths. Time spent in intensive care, a lengthy hospital stay, and a very challenging pregnancy. Following the birth of my son, I continued to be treated for a heart diagnosis that I later discovered was inaccurate. I spent the next 20 years searching for answers. I also would experience severe symptoms that led to additional misdiagnoses, misunderstandings, and mistrust. I had to fight hard to advocate for myself, and while doing so, I grew a passion for advocating for others. I encouraged others with powerful stories to consider sharing their stories. When making the ask, I would get the same 3 reasons why they shied away from sharing. Number 1, they weren't comfortable speaking to large groups. Number 2, they felt that no one really wanted to hear their stories. And number 3, they did not want to revisit their experiences due to the trauma and emotional distress that it caused them. I've discovered during my 13 years of advocacy, speaking, and educating that storytelling has such a powerful impact in healthcare. It can open up dialogue that removes communication barriers that could potentially hinder patients from receiving the best quality of care possible. Patient stories not only humanize medical practice, they are a compelling way to communicate information and provide medical evidence. I believe that some of the ways that we can overcome some of those hurdles that limit patients from sharing their stories are: listen to patients. They want to know that they are being heard, respected, and validated, especially after experiencing the emotional ups and downs of a health crisis. Encourage patients to participate or engage in any community forums that may pertain to their health diagnosis. This may lead to their desire to lend their voice to the mission of advocacy. And provide patients with materials that speak to the significance in sharing their stories, highlighting the fact that their stories have the power to not only change lives, but save lives. Knowledge is power. This is our opportunity to remove the barriers of communication, increase health literacy, and reduce disparities through the power of sharing compelling stories.